Once you've been diagnosed with aortic stenosis, it's important to understand your different treatment options in order to make the best decision based on your specific situation and lifestyle goals. To inform the decision on the best path forward, your heart team will track your medical history and conduct tests to learn more about your heart, including characteristics of your heart, the structure of your artery system, if you have other medical issues impacting your heart health. With this direction, your heart team will discuss possible treatment options that could offer the best outcomes moving forward. If it's decided you're a good candidate to have your heart valve replaced, your doctor may discuss two different procedures. Surgical aortic valve replacement, more commonly known as open heart surgery, is performed by a cardiac surgeon who replaces the diseased or damaged valve with an artificial valve, generally made of tissue or metal. Patients can anticipate staying in the hospital for approximately a week, followed by 4 to 6 weeks of recovery, usually at home. Timing is different for everyone. Transcatheter aortic valve replacement, also known as TAVR, is a minimally invasive procedure in which a small incision is made in the groin. From there, the doctor will insert a thin, flexible tube into your artery to guide a heart valve made of tissue to your diseased valve, restoring valve function. TAVR does not require you to have an open heart surgery and generally has a shorter recovery time. Over time, TAVR has been approved for more patients with severe AS, meaning you may be a candidate for either of these valve replacement options. In a recent patient survey by the patient advocacy organization, HeartValveSurgery, 98% of patients who received TAVR reported being satisfied with it as a treatment option. You have an important voice in the shared decision-making process to help determine the best treatment option to treat your severe aortic stenosis. Understanding your unique condition and weighing your doctor's recommendations in addition to your lifestyle and specific goals for recovery are key to making an informed treatment decision. Shared decision-making is crucial to creating the best path forward and an actionable roadmap for recovery when choosing treatment. In fact, 90% of heart valve patients report conversations with their heart team was the driving influence in their treatment decisions. In preparation for appointments with your heart team, list out all your questions ahead of time. Take advantage of resources like HeartValveSurgery.com, CardioSmart, and HeartHub, and always consider bringing a family member or friend with you. Once you've made a decision on the treatment that is right for you, you're ready for the next stop in your AS journey, preparing for treatment. Visit myinteractiveasjourney.com to learn more and access additional resources.